colleagues, dear friends, dear interested publicity and participants, welcome to our second conference on the topic of virtual care and virtual solutions for substance use disorders. My name is Michael Krausz. I have the pleasure to kick off and kick on and welcome you in the very beginning. And as a first thing, I would like to acknowledge that our work, our research is located on the traditional ancestral and unceded territory of the Musqueam. And given the conference is virtual, we have people from all over the world, from New Zealand to Europe and to other parts of the world, including North America. And we would like to acknowledge and express also the gratitude that we are allowed to work from the territory of their traditional caretakers. This conference is organized through a virtual platform called Hoover. So please be so kind to use the Hoover agenda and to locate the Zoom links for your sessions today on the right hand of the Hoover screen. And you will see also a question and answer section for each session where you can join. Please use that forum to engage with speakers and ask your question. Lastly, you can enable closed captioning at the bottom of your Zoom screen. So this should be fully equipped. So allow me a few words to start off the conference. Why is the topic of virtual care interesting beyond the technology aspect? The situation in the substance use field, especially in North America, but also in other parts of the world, became quite complicated and quite challenging over the last years. Everybody knows that in North America, so in the US, 100,000 people died last year due to an opiate overdose. And that in British Columbia alone, over 2,000 people lost their lives in this public health crisis. So that is not the beginning of that development. We have seen a lack of capacities. We have seen a lot of critical developments in the substance use field. And so the lack of capacity and a lot of other problems are really a good reason to think about how to build new capacity, because the likelihood that the support for this area of medicine and this area of care will increase substantially is not that high as we saw last year. So in order to develop something like a clinical trajectory and to develop a better care, the new developments in technology and developments in other areas of medicine are kind of encouraging, because they allow us to do things virtually which were only happening in person or in face-to-face context before, or could only happen that way. So we have a changing environment and we have new opportunities, and the communication for all of us changed already substantially. So we think in a positive attitude, we would like to, with you, to use these opportunities, and we want to anticipate the change and discuss opportunities by comparing international developments, by comparing developments in Canada, sharing opportunities, and get the ball rolling in terms of new capacities, improvement of the healthcare system, not giving up in the current situation, but rather to develop solutions, become creative, and develop as much synergy as possible. I'm convinced that web-based frameworks and web-based services in psychiatry, but also in substance use disorder care as an important part of psychiatry and medicine, will be shaped and will be significantly changed through mental health, through online mental health services. So the future will be driven by that development. And the quality and the results are very much depending on us. On us means the professionals in that field and also users and families willing to collaborate, willing to improve care as best as we can. So that is the spirit of our approach and of our conference, and we really encourage you to interact and encourage you to use this opportunity. And also beyond this conference, if you have questions, if you want materials, if you want to connect with others, feel free to contact the ICD group and others here and start the conversation on this one. So that was my 5 cents. I'm happy to hand over for some opening remarks to the representative of BC Mental Health and Substance Use Service, who is a co-sponsor of this event, Dr. Vijay Seethapathy. The floor is yours.
Thank you, Michael. Good morning, everybody. Thanks for joining us in such an important call for action from this conference. I'm hoping that we will continue to kind of scale up our capacity into virtual health, have active collaboration among healthcare providers, systems of care, and working on combating or tackling the serious overdose crisis, the pandemic, what we've been going through over the past several years in DC and across the world, particularly in North America. So I'm sure you would have all heard the numbers of people passing away or dying due to the overdose over the past 10, 12 years, and particularly over the past 6 years. This is not about numbers. I mean, this is about people. This is about people who are dying. And we're talking about as young as 11 and 12 having a deadly overdose to as old as 70s and 80s. We don't see much light for this. The 2021 is the deadliest year, and we've lost several lives already. And everybody has had a grim 2020, 2021 due to the COVID crisis, which has taken substantial lives across the world and in Canada. And if you really compare that with the overdose crisis, it's a very small piece. So overdose crisis, what we had, and overdose death is second among the cause of death, just after cancer. But as you compare that with COVID, we're talking about 9th or 10th ranking in it. So you can see how deadly is that. The system has really worked on coming together, particularly in BC, the ministries, other organizations, healthcare, academic partners. They put innovative solutions such as mobile units, outreach teams, treatment beds, and other services, recovery services to combat this. But we're really touching the tip of the iceberg. And there is real need and urgency to kind of look beyond the routine traditional care pathways. And as Michael was saying, it is highly required that we start addressing all the areas through digital health and virtual capacity building. Really talking about the continuum of care across primary prevention, harm reduction, evidence-based treatment, recovery and support, and how can we use innovative solutions such as virtual digital health advances and find ways to enhance the access, remove the barriers, and improving the quality of care. So I urge everybody who is coming to this conference to learn from the experience, from the speakers, from their own work areas, And we really, really, really require to actively work on visioning, transforming the substance use care, combat the overdose crisis, and help us advance through the technology and innovation. PHSA and BC Mental Health and Substance Use Services are committed to work across the continuum, work with multiple partners, and our digital health strategy is looking forward in working with Michael, colleagues, and other folks in addressing this crisis, what we're going through for the past 6 and odd years, and do not see a light at the end of the tunnel yet. So I'm looking forward to hear more from the conference, looking forward to further collaborate, and looking forward to actively work together in transforming the substance use care and using the virtual digital health medium and seeing what we can do further to help the people in crisis. Thank you so much. Thanks, Michael.
Thank you very much, Vijay. We thought it would be a really good thing not only to invite the wise old man to open the conference, but also to invite a student who is heavily involved in substance use work and did his just recently finished his master in experimental medicine. It's my pleasure to invite Jean Westenberg to say a few words to the opening of our event. Jean, the floor is yours.
Thank you, Michael. And thank you, Vijay, for those words. I'd also like to congratulate the organizing committee for putting on this timely conference. So I want to add to a bit of what has already been said regarding virtual care for substance use. But as Michael mentioned, I want to particularly look at youth and the next generation. So even before the pandemic, mental health and substance use disorders were already the leading cause of disability in children and youth worldwide. And so now in the context of COVID, things have only really gotten worse with school closures, university closures, diminished social connection, and disrupted extracurricular activities. And these are obviously having drastic consequences on the mental health and substance use challenges among youth. And all this is happening, as Michael and Vijay already mentioned, in an increasingly potent drug supply, which is especially dangerous for youth who don't necessarily have an established opioid tolerance and are only starting to explore street drugs. In BC, the coroner data suggests that almost 85% of all overdose deaths have to do with fentanyl. And carfentanil, which is almost 100 times stronger than fentanyl, has also been increasingly reported in the drug market. And this has led to obviously dramatic scenes. Dr. Seethapathy mentioned it that last April, a 12-year-old girl died of a suspected overdose in BC. So the youngest person ever died of an overdose in BC. And the increase in highly potent opioids in the drug market has also been reflected in other drug samples. So given the popularity of club drugs among youth, especially in the context of raves or festivals, increasing toxicity has a significant concern for youth. And to add to this, that youth have limited experiences in using drugs, are less aware of the risks associated with substance use, and have worse awareness of their own tolerance. But on our side, we do have the internet and technology. As individuals under the age of 25, we've grown up with the internet in an always on digital world. If we didn't know something, we'd turn towards the internet as our first reflex. And this has largely extended to seeking information on mental health, substance use, and even looking for help. And so our online reality is taking up more and more space in our lives for better or for worse. And the metaverse, or our digital environment, is being developed right before our eyes. And in this metaverse should really be included in digital mental health and substance use ecosystem that is friendly for youth. And some interventions have been brought forward as solutions that can bridge the many gaps between mental health and substance care. But we as youth really believe that it can, but this online reform must also be done in cooperation with youth, and importantly, place emphasis on substance use education, harm prevention, screening for high substance use among adolescents and early adults, early intervention, and even positive development. And so crisis response or youth recovering from an overdose should never have to do that alone, and should have the necessary information to know how to go through it and where to access help. And so as we dive deeper into the digital world, we must also address the digital determinants of health and the unequal access to digital healthcare among youth, which has become more apparent during the pandemic. So I don't want to sound all doom and gloom. I think that this is not to say that the global process has not been achieved. Global progress has really been achieved, and there is still much work to be done, and platforms need to be scaled up and tailored to youth. But we believe that this is possible. So youth think that there is capacity to address our needs, and that web-based platforms will become increasingly critical to reducing harm and supporting our positive development in the future. And so this conference is so timely in that it will help better that and address those outcomes, and hopefully bring people together to work towards a common cause. So with that, I want to welcome everybody to the conference. I'd like to thank everyone for being here, and I'll hand it back over to Dr. Seethapathy for the next step in the conference. Or Michael.
Yeah, John, thank you. I think from my end, it's important to say thank you very much. I really think the younger generation needs to play a more significant role in all of that, because they are already living with a lot of these changes we're anticipating in other areas. But I would like to also say we are not only focusing on, obviously, on the overdose crisis, but the overdose crisis is the dominating and the most critical development in the field. And it's a crisis, as the Chinese say, is always both. It's a risk and opportunity. And we would like to emphasize also the opportunity for change and the possibility to collaborate internationally and to make the healthcare system more effective in response, as we discussed also in the context of the COVID-19 pandemic. But the full story, this is a process. It will take longer. It will change our field dramatically. And we would invite you and we would encourage you to be part of that process, an active part and an open part, collaborating across professions, across disciplines for the good of our patients.